Alright, welcome to Chapter 2, Section 2, Exploring the Skeletal System. This is actually going to be a short presentation. However, I highly suggest you take the time to read through it. There's very valuable information in this section of the chapter. Stuff, whether you know it now or 20 years from now, will be very valuable to know and understand. Alright, so exploring the skeletal system. First of all, the skeletal system is the framework of bones and tissues that support the body, alright? You have approximately 206 bones in your body, as or at least a full-grown adult does. An infant has, I think it's 230 some bones. As you get older, obviously bones fuse together to form one. So instead, you have like two bones that fuse to form one. So that's how you come up with that 206 number. Next, we're going to talk about some different parts of the body. You got different joints in the body. You got tendons, ligaments, and cartilage. All right. Your joints of your body are kind of like what we call your elbow, your shoulders, different movable joints, okay? In your skull, we have what we call immovable joints, all right? And in class period today, I will talk a little bit more about some of these things. Just understand that joints are just places where two or more bones meet, and basically it's a spot where, like I said, it's either going to be movable or immovable, and the different type of movable joints allow for those different movements that need to occur. Next thing is tendons. Tendons are very important in that they connect your muscles to your bones or other muscles, okay? In the biceps, you have a big tendon that comes off of the muscle itself and towards your elbow, and you can feel it's like feels like a little cord. That's a tendon, alright? Ligaments connect bone to bone, alright? Ligaments, the biggest one I always think of is the knee, where you have your MCL, your LCL, your PCL, and your ACL. Okay, and the L in all those stands for ligament. Okay, you got your anterior cruciate ligament, you got your posterior cruciate ligament, you have your medial cruciate ligament, and you have your lateral cruciate ligament. Any one of those is a ligament, and obviously the ACL is probably one of the more well-known ones because if it gets blown out, it has to be replaced. And the only way you can do that is through surgery, and you're looking at somewhere from 6 to 9 months of recovery. The last thing we're going to talk about is cartilage, which is a strong, flexible tissue that allows joints to move easily, cushion bones, and supports soft tissue. Alright, everyone knows you got cartilage in your ears, but in your back you have cartilage between your vertebrae. Except for me, one of my vertebrae, two of my vertebrae, the cartilage is all gone, and it has been since replaced with fake cartilage, shall we say, or fake bone. It is something that as you get older, it tends to wear and tear, and as it wears and tears, you'll feel more aches and pains in those joints. Next thing we're going to talk about is the muscular system. The muscular system is the tissues that move parts of the body and control the organs. You have three types of muscular muscles. Alright, you got skeletal, smooth, and cardiac. Skeletal is like your muscles that most of you are probably thinking of right now. These are the things that help you move, support you upright, keep you, they're what you use every day and you constantly think about using. The one thing is though, they are voluntarily controlled. That means your mind controls them. They do not move just on their own. Now, reflexes, yes, that's more of an involuntary movement, but you can control that too, to an extent. Next type of muscle is smooth muscle. When you think of smooth muscle, think of this. Think of your stomach, your intestines, all those things that move stuff, or even your capillaries, where your blood moves in and out. It's different things that move. Basically, they move stuff without you knowing about it. Okay, this is obviously involuntary. Like I said, you don't think about telling your food to move through your stomach, then your small intestines, then your large intestines. You don't think about those things. Those things happen naturally. Those are what your mind does on its own. That's why we call it involuntary. Last type of muscle we're going to talk about is cardiac muscle. Cardiac muscle is made up differently than regular skeletal muscle, so hence it is its own type of muscle for the muscular system. It constantly is in action. It never takes a break. That is one muscle that you never want to have wear out for obvious reasons. Because obviously with the word cardiac, it means it's your heart and your heart muscles. So it's very important that you you make sure those muscles stay in good shape. Alright. From there, we're going to talk about a little bit about the caring for your bones and muscles. Obviously, the biggest thing is to stay in shape, stay active, and use good posture. Stay in shape means that you don't just, sit on the couch all day. You actually go out and do stuff. You actually be a little active, and those first two really go well together. 60 minutes of activity a day for kids K through 12 is kind of the recommended number. Some of you get that, some of you don't. But I like the last one in there, and use good posture, because posture will really dictate how your body's going to feel later on. Especially if you get caught working in a slouch position for a while and you sit upright and all of a sudden it kind of feels a lot better. That also shows to you what sitting in a good posture will do for you. Eat healthy. Obviously this is kind of a no-brainer to go with if you want to stay in shape and stay active. You need foods that are good for you, things that fulfill what you need. Your muscles need protein, your bones need minerals, so you need to eat a variety of foods to fill these things. Okay, today's conversation was pretty short, but I would highly suggest you take some time and read it. Read it to yourself. I obviously didn't hit every point, but it's a good starting point. And have a good day, and we'll talk to you later.